Did you ever break your front tooth and wondered, oh my God, I have an important meeting tomorrow, or my wedding, or my prom, and I need my dentist to fix it right away? And you broke the tooth and you need something to be permanently fixed on the same day. Well, it can happen. Listen to this exciting episode. But before we get started, don't forget to subscribe, like, and share so that you can follow us for future episodes. This is an exciting and a very informative episode of the Wonder Tooth podcast. And my name is Dr. Radwa Saad. And today we're going to discuss the CAD/CAM technology and how this can save your smile. We're going to show you the teeth, how they look like.
I can't believe it. Oh my God, they're so beautiful.
They look perfect.
They
look perfect. Don't. You deserve it. You deserve it.
Oh,
big smile.
So good.
Look at this. Look at how pretty they are.
They are so nice. Oh God.
You're happy? And I kept pushing you to get them done. And
the other ones were like horse teeth. They were awful.
Your event, if you are going to something important like an interview for a job, or we can definitely help you. Before I get started, let me introduce myself to you guys. My name is Dr. Radwa Saad. I am the host of the Wonder Tooth podcast, and I am a dentist practicing in New Jersey. And I have over 20 years of dental experience. I'm licensed in Canada. I worked there for a little bit and I moved to the US. So I'm licensed here as well, obviously. And I'm also licensed in Egypt. So let's talk about CAD/CAM technology and how this can save your smile. First of all, I've been doing this digital dentistry. I'm one of the top digital dentists. What is digital dentist anyway? I'll explain that to you. But I am one of the top digital dentists on the East Coast. And I've been using this technology for over 10 years now. And I saved a lot of teeth. I create a lot of smiles for patients. So we offer an incredible service to our patients. And how we can do that, let me introduce, but don't forget to subscribe, like, and share. So what is CAD/CAM technology? What am I talking about? Sci-fi? Is it sci-fi really? Like, is it space stuff? This is what really a lot of our patients tell me when they start seeing our machines actually starting to make their crowns or their teeth on the spot. They thought at the beginning, oh, she's gonna fix my tooth. Yeah, she's gonna take that gooey material, send it to the lab. No, we do it differently. And we do it in a very clean and sterile environment that we can fix it in 1 hour, sometimes an hour and 15 minutes if we're talking about few teeth. So let's say a scenario which happens all the time. You're biting on something and you bit on something hard, your front tooth, part of it cracked, and now you're smiling and you have that big hole in your front tooth, and it's not hurting you because it didn't get to the nerve, but you have a big hole in there and you're screaming, oh my God, I have a big interview tomorrow. What do I do? How can I fix this? You cannot really fix that with a temporary filling from the pharmacy. This is a little bit bigger than that. And you call your dentist and your dentist will say, well, I can get you in, but I am going to have to put a temporary, and the temporary look hideous and the color is off, and we have a solution for you. So CAD/CAM technology, it's basically computer-aided design, computer-aided manufacturing. And this is the digital smile design, what everybody's talking about now on social media. What is the digital smile design? How we can recreate your smile to the perfection using this technology. And we have embraced this technology for over 10 years. I think it's actually more than that now. But we have the latest technology. And why not every dentist has it? Because it's a very intimidating technology. And I'm pretty good in computers, but let me tell you, that machine and the big computer that comes with it, it's very intimidating. It's, you are trained to do dentistry in a certain way, and now you have to kind of have like a way bigger vision to be able to understand how it works, play with it, and actually make it work. So I remember when I first got it, I was like, okay, this is really something. It's gonna take me a while. And I took courses, like tons of courses. The company actually is very good because they brought us somebody to train us in the office for like 4 days of intensive training, but there is a lot to do. So I took the first 6 months 6 months. I would go to the office every day that's on my day off or after work, and I would just play with that machine, try to figure it out. Okay, read my notes, read this and look it up. And took millions of courses, traveled around the country to take the best courses from the best speakers really for this particular technology until I figured it out. And I say, okay, now I do it, and everybody's like, oh, that looks so easy. Well, it comes easy when you use it for like a really long time. But I love it because we were able to help tons of patients, if not thousands, I would say close to a lot of them. How does it work? How can we play with it? So what am I talking about now? So I'm talking about the 3D scanning, the 3D milling, the 3D printing as well, and then glazing, staining, making those teeth beautiful and perfect. And how can we do that in the office in a single visit? Yes, we can do that. For me, it's pretty simple. I do this every day. I love it. My team is incredible and they know exactly what needs to be done. And we bring the patient in. Oh my God, I broke my front tooth. Let's say you have the 2 front teeth. Let's say you broke one. So for a dentist, this is the most challenging scenario ever for any dentist, to fix the one tooth, not both of them. But for us, we can definitely help you with fixing one tooth only. And why is that? Because the 2 teeth, you need to have a lot of symmetry when you're smiling. So let's say you broke a tooth and you go to the dentist and they will tell you, oh, we have to fix both of them. I cannot fix just the one because the color, the shape, the lab has to fix them. They have to make them exactly the same so that when you're smiling, they don't look completely off. And they are right about this, but they don't have the technology that I'm gonna talk about right now. So how can we fix that? So you come to the office, we'll bring you in. I usually like to take a lot of pictures, and I have to check the gum. So we usually do like a consultation. The very first thing, of course, you want to fix it today. We will fix it today. I have to take pictures because I want to see also where the gum is. Some patients, they have what we call a low lip line. So basically when you are smiling, you can see a lot of the gum. Like, Julia Roberts, she has a little bit of a gum, not a lot. And some people, they have a high smile, so basically what we call a gummy smile. So you smile big and you see a lot of gum. That can be fixed also, by the way, sometimes by kind of recontouring the gum and making them nice, but that has to be done over a period of time, and that has to be done not for just one tooth, but pretty much if you're gonna make a smile makeover. So we better just fix the gummy smile. But let's go back with, I broke a front tooth. I have an event tomorrow. Help me. That scenario, I've heard it so many times. So how can I do that? So the first thing, you come, we're going to take a picture. Then I am going to scan your teeth. What is a scanner? What am I talking about now? So it's a little camera. So for people who gag, for people who think, oh my God, I cannot have anything in my mouth, the gooey stuff. As soon as you see that gooey stuff coming close to you, you start to feel, okay, I'm about to gag now. Am I right? If I am right, please tell me in the comments below that this has happened to you. Because me too, like I hate those gooey things, when I was like doing braces like a million, no, not a million, like less than that. I would be like, oh my God, I hate that thing. But now there is 3D scanners. So 3D scanners, it's a little camera that we use. Just open your mouth and we just retract your cheeks, and we just take, basically we are capturing the shape of your teeth. And the incredible thing is you can actually see it on the monitor right next to you. So a lot of patients, especially if I'm doing an upper tooth, so the patient is basically like laying down, they start to put their head up and they're looking upside down, and I'll be like, I'm gonna show you, don't worry, I'll show you what I'm doing, I'll show you everything. And they're like, oh my God, I've never seen anything like this. Oh my God, look at my teeth. And it's so incredible for them because they can actually see their teeth while I am scanning them on the spot. Good morning, everybody. We're very excited to add this beautiful machine to our dental office. It's a beautiful digital 3D scanner. We have one, but this is the bigger brother or the bigger sister, and it's a lot faster than it, and we can actually make bigger cases with it now. So this is a ceramic bridge, and look at this now. It's pretty cool, isn't it? Have a wonderful day, each other. Keep brushing, keep flossing, and keep smiling. So what we need to do, we need to scan the biting surface, then we need to scan the outer surface of the teeth, and we need to scan the inside of the teeth. So let's say I am working on one tooth only on this side. I don't have to scan the whole jaw. I just usually like to do like a quadrant. If I'm doing a front tooth, I usually like to scan from premolar to premolar just to have that, the bite. So we scan top teeth, then we scan the bottom teeth, not all of them, depends really where the teeth are. And then I ask the patient to bite hard, and then we do the bite registration. So basically, scan the top, scan the bottom, and then you're biting down, and then we scan the bite. And why this is important, you have to do that before numbing you, because once you're numb, you just don't bite properly. You'll be like, and I'm like, you're not biting, but you can't because you're numb now. So we usually do that before numbing the patient. Then after that, the magic start to happen, because then I'm gonna numb you, and then usually we put a little bit of numbing gel first, then I numb you couple little drops of anesthetic, and then we numb you a little bit more. And then if it's a front tooth, okay, easy. If we're gonna do like a veneer, porcelain veneer or porcelain crown, depending on how bad the crack, how bad it is. Even for a porcelain bridge, well, we're not touching that because a bridge will come later, even for an implant. But let's talk if it's a veneer or a crown. And once again, the difference between a veneer and a crown is important, because the veneer is basically just the outer layer of the tooth. The crown is 360 degrees around the tooth. Okay, the veneer is like around 180, the outer layer. For ladies who get nail polish, it's basically the same thing, but we don't do acrylic, we do it with porcelain. For the crown, we have to go 360 degrees around the teeth, and this really depends on how bad the crack is, because you need to have certain retention and stability. It's very important. If you have something thin but big enough that if I put a filling, the minute you bite on it, it's gonna crack, then I need something a little stronger, which is porcelain. Porcelain is much stronger than composite, which is the white filling. But if it's not too big, a veneer is much more conservative than compared to a crown. A crown, if basically like, let's say 1/3 of the tooth is gone, you still don't need a root canal. And not every crown you need to have a root canal, by the way, guys. I've had patients and I'm like, this is not okay. They've had like smile makeover, so they went to the dentist and the dentist, oh, you need a root canal in every tooth so it doesn't hurt you. This is not okay. This is not okay. If you're going for a smile makeover, it's not okay to get a root canal in every single tooth. Let's say you get a crown or a veneer and the tooth hurts you after that for whatever reason, you can still get a root canal done. We just go from the back of the tooth, we drill, we do the root canal, we seal it, it's done. But it's not okay to have a root canal because, okay, I'm getting a crown. No. Okay, let's go back. So front tooth, we're gonna put a veneer or a crown, whatever. I start to kind of shave the tooth if we decide to do a veneer or a crown. Then remember, we took 3 scans now. One for the top teeth, one for the bottom teeth, and one for the bite registration when you're biting down. Then the 4th one is going to be the new scan that I am gonna do after we shave the tooth. So I'm gonna scan this, and now the magic really is gonna happen, because let's say it's your front tooth, this one compared to this one. So what I do, the important part is I'm gonna select the color with the patient, and I'm pretty good at, selecting the correct shade. A closest one, and of course, if we're gonna do some whitening, you have to let me know. Of course, I just wanna fix my tooth, okay. Then, here is what I can do. I can make a copy of the other tooth, the tooth that, like, the correct one, and I flip it over, and we can make a copy of this tooth to put it on the other side. So when you are smiling, you have exactly the same shape, the same shade, and the same length. That sounds a little crazy, but we can do that. And I've done it so many times. And by doing this, you don't have to have both teeth done at the same time. Boom, right? And I've done it in a lot of occasions, like implant crowns, for example, which is a very, very, very difficult thing to do. And implants, and basically we're gonna put a crown on it, and I can still use the same CAD/CAM technology, and we do it, and basically I make a copy of the other tooth and I flip it over, and boom, it looks exactly the same. That's not all, but after we milled the tooth or the crown or the veneer, it comes out in unfinished stage. Then we start to do the characterization, which means the front teeth, they have certain depressions, certain grooves, certain, mamelons, so we can make that. And then we start to make the tooth more alive by giving it, like, let's say the other tooth, you have that translucent, when you smile big and you see like a little almost translucent at the end, the edge of the tooth when you're smiling. So we can create that too. And let's say your tooth is not completely like white, or you have a little bit of yellowing around the gum line, so we can do that too. And we do that customized, like on the spot while you're sitting, because we have a great team, we have a great staff, and they're all very well trained to do that. So they start to work on the characterization, customization of the tooth. And then we give it the glaze, and then it goes in the oven. And sometimes I would ask the patient, do you want some sprinkle with it? It's in the oven now. And then they start to laugh. They're like, a little bit of sprinkle would be nice, or whipped cream. And we just start to laugh about it. While this is happening, you get your little massage in the chair and you just kind of relax and chill, because your tooth is, it's gonna come in within, usually in the oven, it takes around 15 minutes. Then we let it cool down in another 20. So you stay in the chair for around an hour. To fix the one tooth. Isn't that crazy? Yeah, well, we can do that. The machine is so incredible that we sometimes can do like a whole smile makeover in one day as well. And how do we do that? Same exact thing I talked about. We scan the teeth, we take pictures, and then we, the sequence, we numb you and we start kind of working on the teeth, and then we do the digital smile. And the crazy thing, I can actually show you how the teeth are going to look like on the monitor. So I can show you, and then I have grids and I put it, and we make the tooth exactly the same tooth, like the other one, and you can see that on the monitor. And it's an incredible service. I've had so many patients basically that were like, we don't know how we were doing this before, especially the people who gags and people who cannot really, like you can't get anything in your mouth. I understand, but we are here to help you. We are located in Princeton, New Jersey. And if you need to fix your tooth, broke your tooth, your wedding is coming up, or your prom, or you have an interview or anything, or you just want to fix your teeth on the same day, even if you come, like I have patients who come from Canada, I have patients who come from the UK, I have patients who come from all over the world. And we are able to fix their smile on the same day, because we can. Of course, I always like to bring them back, a couple days after, before they travel, because I need to make sure the bite is okay. When we put, like, let's say we're doing a smile makeover, you're numb. You are numb. So when we put the veneers in, you're numb still. We check the bite, but I always like to bring you back, a couple days later, just to make sure the bite is okay and you are comfortable and you are eating and life is good. Okay? Don't forget to subscribe, like, and share. And let me know in the comments below if you have any questions or if you had any experiences with your dentist about this. As I said, the CAD/CAM technology, this is the future of dentistry. And it's been out there for years now, but not everybody embraced the technology because it's very intimidating and it's very expensive. So feel free to reach out to us if you need to fix your teeth and recreate your smile. And don't forget, if you take care of your teeth, they will take care of you. Until then, keep smiling with Dr. Saad. Have a good one, everybody.